Welcome to the World GNM Day celebrations. This is Dr. Bharat Reddy. And about myself, this is Dr. Bharat Reddy working as a trainee intern in GEMS Hospital, Shamshabad. I was introduced to GNM by Dr. V.S. Reddy, my father, a well-known homeopath, a global GNM practitioner from Telangana, also an adherent follower of Dr. Verghese and Dr. Hammer's theory, which was introduced to him by Dr. Verghese, sir. Initially, I was surprised to know the impact of psyche on our physical brain, and part of me couldn't believe that viruses doesn't harm our body. So, I mean, I was introduced in my medicine third year, and just now cleared second year, learned pathology where everything cause bacteria, virus, parasite, and now we suddenly get to know that viruses doesn't harm. I couldn't accept it, to be honest. But after seeing the cases clinically with my father, I was shocked. I was shocked to see the results. And to which extent I saw the success of GNM, it made me completely believing in GNM therapy. With the influence of fourth biological law, I directly contacted the so-called COVID positive patients without any mass sanitization or distancing, straight from day one of the first wave. And you can see the difference from not able to accept it than to this extent of where I am directly exposed to the COVID positive patients. So that all confidence was given to me completely by GNM. So I'm grateful. I'm grateful to God, and I always feel lucky that I was introduced to GNM at right time, at very early part of my student life, and also to have a passionate teacher like Dr. Verghese is always a blessing. Who made the principle of this divide tool easy for students like us. I mean, it's always easy for a practitioner to understand something like this because of the experiences they have and the knowledge they share. So, but a budding student, a budding practitioner, it's always hard. And thanks to teachers like them who made these teachings easy for us. And I have the ambition to learn, educate, and promote GNM and global GNM and hammer theory. So, my topic. So GNM in a case of precocious puberty. This is one of the cases which I witnessed, and so we're going to have a concise topic of how this developed and what way it got reduced and what's the conflict behind it and how GNM helped to make someone's life way better. So jumping to the case, it's a case of 18 months old female toddler who visited the clinic with complaints of breast development and pubic hair development since 1 month. So usually precocious puberty is a medical condition where the characters of puberty hits early. So it hits somewhere in around age of 8 to 9, which is most common according to the medical books. So, but here it was seen in 18 months old toddler. So we were shocked. When I saw the case, I was shocked because I never seen such young people suffer with precocious puberty, which is very, very, very rare. So it had to do something with her mother. So it was clear by then. So with the history of white discharge and recent gain in height, this is also very characteristic. And if on examination, the temperature was 97.8, height was 80 centimeters, weight was 11 kgs, pulse rate 120, respiratory rate 24 per minute. So this was the case. So what happens in such cases? They already get diagnosed. They go to this multi-specialty hospitals, this endocrine centers. So it was already a diagnosed case. They got all the investigations previously done. So it was a case of benign right ovarian cyst with peripheral precocious puberty with enlargement of uterus and endometrium. So again, precocious puberty has two types. One is central precocious puberty, where something involved in the brain tumor or something related to the brain, and peripheral, something related to the ovaries and uterus. So here it was a peripheral puberty because there was right ovarian cyst. So the conventional medicine doctors, as always, advised to get the surgical procedure done, which is the oophorectomy in this case, and mentioned it's the only way of saving the girl from malignant state. So the fear was already improved. If you don't do this, then your toddler might fall in some risk. So That was there. You can see telarchy. Telarchy is where you can see the development of breast. So you can clearly see the breasts were developed. She was just 18 months. She was just 18 months. You can see the pubic hair, pubarchy. So it was something very bothering seeing this in 18 months old toddler. And so yeah, these are the prescriptions of whom they consulted before us. So, endocrine center, Maltese Women Hospital. These are the reports. And you can see to the left corner, the estradiol levels rising up to 856, which is very, very, very high. So usually estradiol levels at this age for that toddler has to be somewhere below 2010. And usually estradiol levels in pre-menopausal women rise up to 350, which is normal. But see here, it's 850 in a toddler. So it's something very, very high. And they got the scanning also done, which helps us for diagnosis. The right ovarian cyst with peripheral precocious puberty, enlarged uterus and endometrium. So this is the baby.
1.5 years. 1.5 years. 1.5 years.
See, we were asking what's the age. They were saying 18 months, 1.5 years. You can see the breast developed already. Okay. The real task for any physician in handling such cases, first you need to make the baby comfortable and so conflict. So what could be a conflict in an 18-year-old toddler? That's the important thing. So what could be the conflict? If she was somewhere mature, then you can probe for something. But what could be an 18 months old toddler? So let's go back to the history. In early days of the mother's marriage, her father, the mother's father, was diagnosed with cancer. What does cancer mean to a common people? It is death. People get diagnosed, they start to have the fear of death eventually. So after a few months, the mother got conceived, but the thought of her father going to die was very persistent. Throughout the pregnancy, was very persistent. She was crying constantly, going to hospitals with him, watching him taking chemo, radiotherapy. Later, she developed baby at full term, no complaints, normal delivery. So after 2 months of the birth, eventually her father expired. And the mother is now suffering with the loss conflict. So now the question arises in our mind is, should we consider the conflict of mother in the suffering and in the treatment of the baby? And yes, we should. Because here, the mother, the child, they aren't separate entities here. The thought process of, I'm going to lose my father was persistent throughout the pregnancy. Pregnancy is a phase where the mother and child are connected. So the conflict was shared by the baby here. That's why pregnancy in such cases values gold dust. This was told by one of our great guru, Dr. Praful Vijayakar sir. So the baby was born with the susceptibility, and death of the mother's father might as well trigger the baby to the loss conflict, and by as a reaction producing more estrogen. And why more estrogen all we'll see in further slides. So loss conflict concerning the ovaries only. So development of ovaries. Ovaries originate from the new mesoderm. Ovarian tissue contain interstitial cells, which are responsible for production of estrogen and slight amount of testosterone. So estrogen, what does estrogen play? Estrogen play a significant role in women's sexual drive, a readiness want to mate. Ovarian cells are again controlled by cerebral medulla. So biological conflict, loss of loved ones, could be mother, father, pet, even the fear of losing the beloved ones. You have the fear, this might as well trigger the conflict. Constant self-blame following the breakup. Oh, we parted ways, the relationship couldn't work out because of me, the marriage couldn't work out because of me. So even such thoughts and death of someone close can keep the conflict active. So, and this conflict can also be activated by arguments, betrayals, unfaithfulness of the partner. So all this can also activate the conflict. So now this is the really most important slide. So, healing phase. The tissue loss is replenished with new cells. So the loss which happened is replenished with new cells. A special characteristic regarding the healing of ovaries is the development of the ovarian cyst. So this is the very, very important point here. So the cells which are lost, the new cells are grown, and it shows a characteristic development of an ovarian cyst. So the biological purpose. So everything happens for a purpose, they say. The biological purpose here, the boost of estrogen provided by cyst makes the female who lost an offspring or a mate more attractive and increasing at the same time her readiness to mate, which puts her in ideal situation to make up for the loss and to become pregnant again. So the estrogen levels here are raised, which has to be raised in the woman, but raised in the baby. So raised to make her more attractive, to make her ready to mate, to compensate the loss, conflict. Here the estrogen levels usually rise. So all organs derived from new mesoderm show biological purpose at the end of the healing phase. This is very important because sometimes we get confused whether it's the healing phase or the conflict active phase. So if you are able to differentiate whether from which the organ is developed, then this will help us. This will help us a lot. So loss conflict, ovarian parenchyma, you can see the uterus clearly, ovary, and indicating loss conflict. So in this case, the conventional doctors have diagnosed it as benign ovarian cyst and advised to get it removed as soon as possible. If not, your child will land in malignancy. These were the words said by the mother. So GNM understanding here, the grandfather's death, the intensity of conflict was very high since it's her father. The ovarian cyst appears during the healing phase due to the cellular multiplication of the interstitial cells. Since there is an increased level of estrogen, the secondary sexual characteristics have developed. Okay, the conflict was received from the mother to the baby. It was shared by the baby. In conflict active phase, the interstitial cells were affected. That's why you can see the rise of estrogen levels. So here, the mother was made sit down, explain about the GNM therapy, told her that her baby is now suffering because of the conflict, because of the loss conflict you have experienced by the loss of your father. And after our explanation, she was very much convinced. We counseled her to accept the death, because here it falls important. Death is part of life, which you can't avoid, which you can't change. You just need to accept it. I know it's easier said than done. So it takes time for anyone to accept death of someone close. So once she accepted, she was very much relieved. And we can see when we were counseling, the patient was grieving. She was venting out all the emotions which she's being carrying around. And so now let's see the follow-up. The follow-up, GNM therapy, after GNM therapy. The breast size reduced, pubic hair disappeared, white discharge completely stopped, growth became to normal. Most importantly, the estradiol levels, which were 856, have come to less than 10. So this is the miracle. This is the magic, my friends. So This is what GNM can do. Yeah. What's the difference we've been asking, sir? 50% of the breast size has been reduced. This is in the first follow-up, my friends.
Happy, happy, sir.
The mother was saying, yeah, I'm happy. And we were asking about the growth. The growth is also normal as well. You can see the breast size have reduced. You can see now the baby. So the breast size is reduced. There are no trace of pubic hair. This is my father. And those are the parents. So you can see the breast size has been reduced. That is very important. And the estradiol levels, which are 856, have gone to below 10. It shows that the case is going in great direction. And see the baby, see the pubic hair, not only saved her, but saved her next generations as well. What if she would have gone to surgery? She would have lost the beauty of being the mother. She would have the trouble of the surgery all her life long, and she would have just not been the other girl, and she would have regretted it for whole life. And now she has been saved, her progeny has been saved, the next generations by her has been saved. And that's the power of GNM. That's the power of GNM. Nothing we did. All thing has to, credit goes to the GNM. So this is in the first visit. You can see the breast increase in size. There were breast and there were pubic hair. And next you can see the breast size have reduced in the second follow-up. Pubic hair slightly there, but mostly disappeared. And you see the third follow-up. Breast size completely normal, pubic hair completely disappeared. No history of white discharge since then. Completely stopped. So this was after GNM therapy. You see the estradiol levels. They are below 10. Below 10 here. So from 856 to below 10. So then special mentions to the man himself. Without him, I think this wouldn't have been possible. So to the dynamic revolutionist who, with his discovery, with his wonderful discovery, has saved millions of lives and millions of humanity, thanks to this great man. And how can I conclude without mentioning about Dr. Verghese, sir, the man who created this revolution in India with GNM, with his teachings, educated thousands of doctors, many students like me, put us in right direction. Sir, we'll always be grateful for this, sir. And thank you, sir, for providing this wonderful opportunity. And thank you, everyone, for listening. Thank you.